just easy. All right, so I'm just gonna introduce the problem. Maybe I'll ask you exactly where it's bothering you, that kind of stuff, okay? Oh, hey guys, Dr. Randy, got Mercedes in the office today. We're gonna do a full spine adjustment. She's having some lower back pain, even some sacral tailbone pain and SI pain. What do you attribute that to, Mercedes? Was it old injuries? Do you think it's the nature of your job?
It might be between my job. I think that aggravates it a lot.
Okay.
But I started to notice a lot more issues with my tailbone after I had my children.
Okay, and that's
like my hips and my tailbone.
Yep, that's a very common complaint. So, how many kids do you have?
I have 4 total. 3 of them I birthed. So.
Okay, so she has multiple kids. So when, obviously going through pregnancy, the oxytocin causes a ligamentous laxity in women. And so if you're not getting adjusted throughout that pregnancy, which we recommend everyone does, you're gonna heal from that, when you have the baby and there's less oxytocin, there's less ligamentous laxity, things are gonna heal, but you may heal misaligned from that. So it's very common to have back pain or issues come up after. And that's why, because your ligaments, became loose essentially for the purposes of having the baby. But then once that went away, you healed, but you healed misaligned. So we see a lot of low back pain for her. Like I said, it's the sacral and the SI pain. So just something to keep in mind if you or know anybody that is, we have these tables that drop out that make it very comfortable even for women in the later stages of pregnancy to lay face down and get a lot of good work done. And we see ladies from 1 week pregnant all the way through their pregnancy all the time in the office. So, okay, let's get her adjusted here. So we love our table work. It sounds very loud, but it's extremely comfortable for the patient. I can fix her pelvic unleveling and her SI restrictions, just a little bit of drop. Take a deep breath in, Mercedes. Let your arms hang all the way out. Blow it all the way out. Good. And just an easy adjustment in her mid-back. Go on your side, facing me, please. Nice deep breath. Exhale. Good. Perfect. Other side.
Sorry.
Deep breath in. Exhale. Nice. Good. So that's her low back. And we're going to do a little bit of deflection distraction. Let's finish adjusting her neck and her upper back. Okay, Mercedes, take a deep breath in. Exhale, right back on my hand. Good. And the last one. Nice. Get your neck adjusted. Just slide back towards me just a little bit. Perfect, right there. Just relax your shoulders. Good. And this one. Perfect. Pick your head up for me. Relax it back down. Good. Very good adjustment. One more stretch. Good job, Mercedes. Stay right there. You will pull me, hang onto the table on both sides. I will pull in this leg, just with the shoulders. There it is. Go face down again for me. So really that's basically it. She's doing a lot better with the issues since she's been coming back in. We're gonna do this flexion distraction technique on her, which is really good for SI, sacral pain, tailbone pain that she's having. So just a good stretch for the facets, good stretch of the ligaments. So with flexion distraction, I'm pinning with my left arm. I'm on right around L3. So L3 and above is gonna be sort of more stationary, and that gives an extra stretch for below L3. So the L3-4 joint, the L4-5, L5-S1, and then with this lateral flexion, I can get a little bit of SI joint stretch, and then if I move my hand down, I can really focus on the sacrum and tailbone, which is where she's having her pain. It's a very hard movement. No stretch or anything you can do exercise-wise or stretching-wise or PT-wise can really duplicate this action for the lumbar spine. So usually get like a little bit of popping and release of joints just doing this. You okay?
Mm-hmm.
I can feel how tight her back still is though through here. But Versailles, so far very good. So that's basically it. I'm gonna do a little more muscle work, but for the purposes of the video, she's done. Just really keep in mind, if you've had kids, you're having low back pain, you're having tailbone SI pain that she's having, sometimes it goes down the leg, it's a radiating sciatic pain, get yourself adjusted. Don't just mask the symptoms. There's joint dysfunction there that's irritating discs, that's irritating nerves. It's something that's a very simple fix here in the office and can prevent, years of ongoing problems. All right, thanks.